File photo Rachel Levine, nominated as Assistant Secretary at the Department of Health and Human Services, testifies at the Senate Health, Education, Work and Retirement Committee hearing on Capitol Hill, Washington, USA, February 24, 2021. Receiving Tom Brenner Pool File Photo License Rights August 30. The U.S. Department of Health and Human Services said on Wednesday, following a review request from the Biden administration last year, that a department spokesperson had recommended easing restrictions on marijuana. About 40 U.S. states have legalized the use of marijuana in some form, but it remains completely illegal in some states and at the federal level. The reclassification of marijuana as less harmful than drugs such as heroin would be the first step towards broader legalization, a move supported by the majority of Americans. The spokesperson said planning proposal for marijuana was submitted to the Drug Enforcement Administration on Tuesday as part of President Biden's directive to HHS. A DEA spokesperson said, as part of this process, HHS has conducted a scientific and medical evaluation for consideration by the D. The D has final authority to schedule or reschedule a drug under the Controlled Substances Act. The D will now initiate its review. Marijuana currently classified as a scheduled drug under the Controlled Substances Act. This means that with drugs such as heroin and LSD, the potential for abuse is high and its medical use not accepted. The HHS recommends reclassifying cannabis to say it has moderate to low addiction potential and lower abuse potential, putting it in the same class as ketamine and testosterone. If marijuana classification is relaxed at the federal level, this could allow major exchanges to list businesses that trade cannabis, potentially allowing foreign companies to start selling their products in the United States. Marijuana is legal in Canada, which has become the home of public cannabis growers and distributors in North America. Most are expected to spread to the U.S. after federal legalization. Shares of several cannabis firms rose on the news, including Canopy Growth, Tilray Brands, and Cronos Group. Firms such as Verano Holdings and Sunburn Cannabis have pushed for HHS's move, welcomed. For too long, cannabis prohibition and its outdated status as a substance have unfairly harmed countless individuals affected by the failed war on drugs, said Verano's CEO George Arcos. Report by Saurasis Bose and Miralika Roy from Bengaluru. Edited by Shilpi Majumdar, Shunak Dasgupta and Shailish Cuba.